Etiology of Tian Huang. Emotional stress is the main etiological factor of bipolar disorder. Anger, worry, excess, joy, and guilt may all be the initial cause of this disease. The initial qi stagnation resulting from emotional stress generates heat, which harasses the mind. The stagnation of qi in the triple burner leads to impairment of transformation of fluids and therefore to phlegm. This is also aggravated by the condensing action of heat on fluids. Anger, shock, and fear injure liver and kidneys. These become deficient and lose the nourishment of water, which causes tian. Excess joy and anger injure heart yin. This leads to heart fire and quan. Pensiveness and worry injure heart and spleen. The heart loses its nourishment, the spleen cannot transform, and this leads to tian. Worry and pensiveness injure heart and spleen. The spleen cannot transform and transport, and this gives rise to phlegm. As phlegm plays a central role in the pathology of bipolar disorder, irregular diet is an important contributing factor to its etiology. Excessive consumption of dairy foods, fatty foods, carbohydrates, and sugar leads to the formation of phlegm. Phlegm may also be formed when the person eats in an irregular and chaotic way, that is, eating late at night, eating in a hurry, eating while working. A constitutional tendency to mental emotional problems plays a role in the development of bipolar disorder. Both children and adolescents can develop bipolar disorder. It is more likely to affect the children of parents who have the illness. From the point of view of Chinese medicine, a tongue with a deep heart crack indicates a tendency to mental emotional problems. In Tien, there is often phlegm with qi stagnation and a deficiency of heart and spleen. In Quang, there is often phlegm fire, agitating and obstructing the mind and eventually leading to yin deficiency. In chronic cases, the qi stagnation and the phlegm may also give rise to blood stasis. Pathology of Tian Quang. The pathology of bipolar disorder is complex, especially in chronic conditions. In the beginning stages, there is qi stagnation, fire, and phlegm, while in later stages, there is also a deficiency of qi, blood, or yin. The manic stage is characterized by more fullness, while the depressive stage is characterized by a mixture of full and empty conditions. Four words could summarize the pathology of bipolar disorder: qi for stagnation, fire, phlegm, and stasis of blood. Central to the pathology of bipolar disorder and Tian Quang is phlegm. Bipolar disorder is a serious mental illness characterized by loss of insight. In Chinese terms, this is due to obstruction of the mind's orifices. The mind's orifices can be obstructed by phlegm or by severe blood stasis. In bipolar disorder and Tian Quang, the mind's orifices are obstructed principally by phlegm, although in later stages, blood stasis may also contribute to the obstruction. Obstruction of the mind by phlegm accounts for both the manic and the depressive phases of bipolar disorder. Please note that phlegm does not derive only from a spleen deficiency. Qi stagnation may give rise to phlegm by obstructing the free flow of qi in the three burners. Fire can also give rise to phlegm by condensing the body fluids. Blood stasis, which itself derives from qi stagnation, aggravates phlegm. In bipolar disorder, there is usually also fire, which agitates the mind and ethereal soul and stokes up the manic behavior of the person. In chronic cases, fire injures yin and the resulting empty heat further agitates the mind. Furthermore, the qi stagnation that is usually present in the beginning stages of bipolar disorder may also give rise to blood stasis. This further clouds the mind's orifices. The pathology of the manic phase of bipolar disorder is characterized by qi stagnation, phlegm that clouds the mind's orifices, fire which harasses the mind and causes mania, blood stasis which obstructs the mind's orifices further, and yin deficiency. The main organs involved are heart, liver, and spleen. Another essential characteristic of the pathology of bipolar disorder in its manic phase is the excessive coming and going of the ethereal soul, the hun, resulting in the flooding of the mind by ideas, projects, plans, inspiration in a chaotic way that leads to mania. The mind needs to control and integrate the psychic material deriving from the ethereal soul. The mind can deal with only one thing at a time. Flooding of the mind by the psychic material deriving from the ethereal soul results in total immersion of the mind within the ethereal soul and therefore mental illness, as in bipolar disorder. The pathology of the depressive phase is characterized by a mixture of full and empty conditions. In the beginning stages, there is chi stagnation and phlegm, which obstructs the mind's orifices. In chronic cases, there is a deficiency of the heart and spleen. The main organs involved in the pathology of bipolar disorder are therefore the heart, liver, lungs, and spleen.